Namaste everyone, I am NEHA GUPTA, student of MBBS first year. Today we are going to discuss about thoracic cavity and pleura. The thorax is an osteocartilaginous cavity which is meant for the protection of various viscera like lungs and the heart, and it is not only static but dynamic, which is very much visible in case of respiration. The thorax is supported by the skeleton framework called thoracic cage. Pleura is a serous membrane which is lined by mesothelium. The outer one is called the parietal pleura, and the inner one, which is attached to the lungs, is called as the pulmonary pleura or the visceral pleura. The outer one, called the parietal pleura, is thicker than the visceral pleura, and parietal pleura has four parts: costal, diaphragmatic, mediastinal, and the cervical. Cervical pleura is present at the apex, and it is about 2.5 cm above the medial 1/3 of the clavicle and 5 cm above the first rib. The costal pleura lines the thoracic wall. Mediastinal pleura present towards the mediastinum, and the diaphragmatic pleura which lines the diaphragm. Recesses of pleura are the reserve spaces which is very helpful during the deep respiration. These are of two types: costo-mediastinal and costo-diaphragmatic. Here we can see is the costo-mediastinal recess, and towards the diaphragm it is costo-diaphragmatic recess. Pulmonary ligament is a type of parietal pleura which descends downward as fold, and this is only called as pulmonary ligament, which is actually a dead space and is helpful when there is more venous return, and thus helping in expansion of pulmonary veins. Visceral pleura is the pleura which is attached to the viscera, that is lung. Talking about the nerve supply of the pleura, so for the parietal pleura it is the somatic nerves, that is the intercostal nerve and the phrenic nerve, which has the root value of C4. Major point is that the parietal pleura is pain sensitive. Visceral pleura is supplied by the autonomic nerves, that is the sympathetic and parasympathetic. Parasympathetic derived from the vagus nerve, and sympathetic derived from 2nd to 5th sympathetic ganglion. Blood supply of the parietal pleura is same as that of the ribs. For arteries it is intercostal arteries, internal thoracic arteries, musculophrenic arteries, and in case of veins it is azygous vein and the internal thoracic vein. Blood supply for the pulmonary pleura or the visceral pleura are bronchial artery and the bronchial veins, and bronchopulmonary lymph node for drainage of lymphs. Some of the clinical aspects are paracentesis thoracic, which is aspiration of any fluid from the pleural cavity. It is done usually in the 8th intercostal space, and the needle should be passed through the lower part of the space to avoid any injury to the principal neurovascular bundle, which is vein, artery, and nerve. The cervical and the parietal pleura is innervated by the intercostal nerves, the visceral by the autonomic nerves, and mediastinal and central diaphragmatic part by the phrenic nerve. Hemothorax, pneumothorax, hydropneumothorax, and empyema are another clinical aspects. Thanks for watching and do subscribe.